Welcome. Thank you for joining me today as we talk about a super important topic, and that is statins. Statins and healthy longevity. And do they actually go together or not? And why is it that I felt like I needed to talk about this topic? Well, several reasons. The first reason is because I asked the question in the group, um, I don't know, a couple weeks ago, what is your biggest fear about being overweight? And hands down, the number one answer was health. Not any more specific than that, but I thought, there's a lot of aspects of health and being overweight. One of those is heart disease. Heart disease is the number one killer of men and women in this country. It has been for a really long time, and we have a lot of different medications to deal with heart disease. So I thought, that's a good place to start, is just to pick the one that's the number one killer of men and women in the United States and has been for years. The other is I talk to so many people, I see so many people that are either taking statins or they're asking me about statins. Their doctor recommended that they get on a statin, like it's nothing, like vitamin C. So the doctor says, take vitamin C every day or take a statin every day. And so the seriousness of the statins, I feel like, is being swept under the rug a little bit. And so I feel like I want to address that. So thank you for being here. Thank you. And for those of you who are watching the recording, I appreciate that. And I hope that you get some good information from this talk about statins. So let's talk about this number one killer of men and women in this country, which is heart disease. Where does it come from? So first of all, I'm going to give you a little bit of background. Coronary heart disease has killed more people than all of our wars combined. It affects nearly everyone raised on the standard American diet, and believe me, that's just about everyone, especially in our age group, middle-aged, 40s and up. They were raised on the standard American diet. What is this number one killer? It is fatty deposits in the walls of your arteries. That's the bottom line of it. You get deposits that are deposited, you get fat that's deposited in the endothelial lining of your arteries, which, what does that do? It narrows the artery so the blood can't get through easily. And it also does a few other things. And what this is called is atherosclerotic plaque. What is plaque? Plaque is hard. Look at the plaque on your teeth. When the dentist chips off the plaque on your teeth, they're hard flecks. It's not soft and it doesn't become gel. It's hardness on the inside of your arteries. And what does that do? It hardens your arteries. I'm going to talk in a few minutes about the function of the arteries, and I'm not going to give that away just yet. So what coronary artery disease is the arteries that feed the heart. Okay, so the heart has to have all kinds of nutrition and oxygen and all the metabolic waste taken away, as well as the rest of the cells in the body. And the heart and the brain are massive consumers of nutrition, of this nutrition and of the oxygen. And so they've got to have a lot of it. Well, when you get your coronary arteries filled with plaque, then the blood flow can't flow to your heart to feed it. And if there's a blockage, that's called a heart attack. So you get this plaque on the inside of your arteries, right? And then what happens is the blood can't flow through. But what if a piece of plaque chips off, right? And then it creates a blockage. So your heart isn't getting any blood for nutrition and oxygen. Well, that creates a heart attack. That's what a heart attack is. So hopefully then the pressure builds up behind that blockage and pushes the blockage through, but then you're just pushing that piece of plaque, that hard plaque that created the blockage in the first place, into the heart. which that's not good either, but at least it's getting some blood flow in. So many people have symptoms of heart disease or coronary artery disease or from atherosclerosis for a lot of years. It looks like angina, it looks like chest pain, it looks like inability to breathe, or you can walk a few steps and you have to stop and take a breath, or you can't walk up a flight of stairs without breathing heavy. So a lot of different kinds of symptoms of heart disease, but a lot of times, and so often, that they've actually given it a name. So this is not something that just happens every now and then, but it's called sudden cardiac death. And that means you don't have any symptoms ahead of time. You're going along in your life as normal. You kind of have, like, quote unquote, this normal amount of plaque in your arteries, so you think, right? Because we all have some, because we grown up on the standard American diet. Or we've been introduced to the standard American diet at some point in our lives. And you're going along in your life, and all of a sudden you have a heart attack, and that blockage doesn't clear, and you're dead in an hour. And that's called sudden cardiac death. And it's when somebody has no symptoms at all of a sudden they have a heart attack and they die. And this happens often. Does it happen every time? No, because most people will have symptoms of heart disease before they have a heart attack, or they have a heart attack and then they live through it, and then they get their symptoms managed in some way. So I wanted you to know that just because you're symptom free right now doesn't mean that you don't have some kind of heart disease. So first of all, excuse me, I want to back up for a minute and talk about what is cholesterol, because cholesterol is the culprit here. And I'll talk more about that in just a minute. But what is cholesterol? Cholesterol is actually made by the liver. And it's because it's such an important part of some body functions, like, for instance, cell membrane integrity. So every cell in your body requires cholesterol for the to maintain the integrity of the cell membrane. Now, it's got some other functions, but basically the body needs cholesterol, and the liver makes cholesterol for the body. The liver makes almost enough for the body, but there's a requirement that we get it from food as well. and so we're able to get the rest of what we need from food. So why is it that our cholesterol levels are so high? It's because of the food that we eat. The food in the standard American diet, even if you think you have a clean standard American diet, so it's no longer standard, but it's an American diet, it's what people typically eat in this country, you're probably getting in your diet more cholesterol than your body actually needs. And so your liver has to deal with it. So it gets absorbed into your bloodstream. And depending on how high your cholesterol is, it can be creating atherosclerosis, and it can be creating heart disease. So cholesterol is a waxy, kind of a fatty substance. And that's why it makes such great building material for the cell wall. That's what it's required. And so what we want to do is we obviously want to keep our cholesterol levels at a level that our body can use the cholesterol that's there in healthy ways and doesn't have to deal with extra cholesterol, right? So when does this start? When does heart disease start? When does atherosclerosis really start? It actually starts, believe it or not, in childhood. So as children, we eat a certain way. And doctors, have actually seen fatty streaks in children's blood. That's not good, because those fatty streaks that are in children's blood end up as cholesterol deposits on vessel walls as the children get older, like in their 20s, even in their 30s, and certainly then as they get older than that. But these deposits happen at a young age. We just don't know it, right? Unless we have it measured, unless we have pictures taken. So really, even at a young age, we're in heart disease reduction, right? As well as prevention, because early on, We need to be preventing heart disease and these fatty streaks. We need to be preventing those as children. So as parents of children, we need to be paying attention to their diet. And we think they're kids, they can eat anything and get away with it, but that's not really true. That thing that we have in our mind about kids can eat anything and get away with it is actually setting them up for chronic disease later in their life, but maybe not that much later these days. I mean, kids are obese these days, and they're getting these chronic conditions. They're getting diabetes, type 2 diabetes, early on. That doesn't have anything to do with statins, so that's another lecture or another talk. So right now, the thing to do with our kids is to start teaching them about food. How are we going to learn about food? If we've got to change our diet ourselves. So let's continue on with heart disease. Because I think it's really important to point these things out so that you understand where all this comes from and why we're in the state that we're in this country right now. So we understand about cholesterol and where it starts. There's a doctor by the name of Dr. Roberts, and he is a top authority on heart disease. I mean, all things heart disease. He's got a center, he's got all kinds of research, publications, books. He's got a client base. He's just seen all of it. And what he has found is that the number one culprit for all heart disease is cholesterol. It doesn't result you can have any other comorbidity, like diabetes, for example, or being obese, like really obese, or any other of the chronic diseases. And if you don't have high cholesterol, you're probably not going to have heart disease. And the flip of that is true too. You could have everything all in alignment. Your blood work looks perfect except for your cholesterol. You could be the right size weight or the right size for your body. You can exercise, you can eat right, but if your cholesterol is high, chances are you're going to get heart disease. So cholesterol, what that means is that high cholesterol is almost a guarantee that you're going to get heart disease no matter what else is going on. And if you don't have high cholesterol, you probably won't get heart disease. No guarantees, but probably not until your cholesterol starts going up above 150. So you can see with all that information why drugs that reduce cholesterol, especially LDL cholesterol like statins, we're reducing the deposits, right? The plaque deposits. Why these drugs are so popular? Because we're trying to reduce the statistics of heart disease being the number one killer of men and women. And if cholesterol is the primary risk factor for heart disease, then we want to get cholesterol down, right? So your doctors know this. Your doctors know that cholesterol is the number one risk factor for heart disease. So they're going to do whatever it takes, right? Whatever's in their power. And what's in a doctor's power is drugs, prescription drugs. That's what they know best. That's what they know about. And that's what they're going to give patients to help manage their cholesterol. Lipitor, one of the top, statins, has become the best-selling drug of all time, generating more than $140 billion in global sales. That's a lot of money. So there's more at play here, and I'm not going to jump on my my cynical soapbox just yet, but you might get a flavor of that. Doctors are simply prescribing these drugs. I think that doctors are brilliant. I don't have anything going on with doctors. I think they're brilliant. I think they have the best interest of their patients at heart, and they don't understand nutrition. They weren't taught nutrition, and unless they've done pretty intensive studying and research and looking past junk science, they don't know about nutrition. So that's what I kind of bring to the table here. So I want to talk a little bit about science, because for those of you who know me, you know that pretty much everything I do is based in real science, real studies, not industry-funded studies, not junk science, real, actual randomized controlled trials and studies like that. So there was a study done, and it was shown that doctors prescribe at least one medication per year to 70% of their patients. And this is for chronic disease. This isn't like an antibiotic for some kind of bacterial infection. This is chronic disease. All in all, in sum, doctors prescribe about 4 billion prescriptions for drugs every year in the US. That averages to about 13 prescriptions for every human in the US. That is a lot of drugs. And guess what the 2 most commonly discussed drugs are? Statin and blood pressure meds. Lowering the blood pressure, lowering cholesterol. The 2 biggest culprits in heart disease. So, wow, if heart disease is such a huge problem, and the things that we talk about the most in terms of drugs are statins and blood pressure medication, what else is there? Here's the thing, and this is what gives me the most pause, I think. Patients believe that statin drugs are 20 times more effective than they actually are at preventing a heart attack. That has me take a deep breath, because what that tells me is that they weren't informed properly, that their doctors write a prescription for a statin and the patient thinks, this is all there is. This is all I need to do. I just take a pill every day and I can eat what I want and I can live like I want to. And this is my safety net and it's going to catch me no matter what my lifestyle is. And that simply isn't true. We're in just a couple minutes, we'll talk about the effectiveness or lack thereof of statins, because it's quite surprising and quite horrifying, really. Most people surveyed said they wouldn't even take the drug, the statin, once they found out how ineffective it actually is. So again, the doctors want their patients to take the drug, so they're not going to tell them that it's, it only helps a small percentage of people. So the best statin drugs may, this isn't a guarantee, this is a possibility, may offer a risk reduction for heart attack up to 3% over 6 years. So we're not talking about a year or two. We're talking about over 6 years, you might get the risk of you getting a heart attack reduced by 3%. That's it. Meanwhile, the right diet and the right lifestyle choices has been shown to work 20 times better, potentially reducing your risk of a heart attack by 60% over less than 4 years. So the amount of time for it to work is significantly less, almost half, and then the drug, the diet over drug, lifestyle change over drug, and the risk reduction is 60% versus 3%. To me, that's pretty compelling. There was another study that was published just a few years ago showing that in advanced heart disease, this isn't even mild heart disease, this is advanced heart disease, switching to the right diet may prevent further cardiac events in 99.4% of patients. That's compelling. And one more piece of information about that. The pills, the statins, may not work in the near term. So basically what we talked about earlier was it takes 6 years to really get the effectiveness. So for years 1 to 5, it's not going to work in 97% of the cases. And your doctor doesn't really tell you that. Doesn't tell you that it's not going to work for you unless you're in that 3%. So why are doctors still prescribing them? Because they're casting a really, really big safety net, right? They're casting a really big net to catch that 3% of the population that the statins will help. Now, on the other side of it, they don't know about nutrition. They don't know about lifestyle. They are also concerned about compliance, lifestyle, if they make lifestyle suggestions about compliance with those suggestions, very valid concerns. Their doctors get about a minute's worth of education in nutrition in medical school. 1 minute, or actually less than one course, I think. So seriously, they just don't know that food is medicine and medicine can be food. So they don't know that. What they get educated about is drugs, drug interactions, how drugs work in the body, and how to prescribe drugs for certain conditions. That's what doctors get educated about. And I'm not minimizing that. I would never tell you to go off your drugs, the drugs that your doctor has prescribed for you. I would never tell you that. All I'm saying is have a conversation with your doctor and ask him the effectiveness, because there's a better way. Plus, I wanted to also say that there is a corporate interest in the nutrition education for doctors, and that corporate interest actually sponsors that education. McDonald's, Frito-Lay, General Mills, Coke, PepsiCo, they all have money invested in educating registered dietitians as well as doctors about nutrition. To me, that doesn't give me a lot of confidence in that education. So let's look at some side effects of statins that they also don't really tell you about, except unless you're watching the TV commercials for Lipitor or other statins, and you listen very carefully to the list of side effects. That takes, the auctioneer kind of guy who speaks that fast. If you listen to him at the very end, then you get a list of side effects, but you kind of discount them because there's so many of them. And how could they put a drug on the market that might kill you, right? It's supposed to lower your cholesterol, but actually it might kill you. How can they put that on the market? Well, they do. So one of the big ones is liver damage, and that's due to liver toxicity. So this drug is so strong that it actually toxifies the liver. And so if you're on a statin, your doctor is going to ask you to get blood work regularly, like once a quarter, because he wants to make sure that your liver is still functional and it's not overly toxic. Is it toxic? Yes. But if it's overly toxic, then you're going to lose functionality in your liver, and your doctor doesn't want that either. Another thing is muscle damage, muscle atrophy, muscle weakness, decline in strength and muscle performance. So as women, postmenopausal women, that would be me, we have to deal with that anyways. So now we're adding a drug to the mix that's going to supposedly reduce our cholesterol, but only if we're in that 3% that it's actually going to help. And it's making our muscles even weaker. So why is that important? Because we require some level of strength just to live our lives, just to be on the planet and do what we came here to do. We require some muscle strength. Plus, if we fall, if we lose coordination because of our muscle weakness, that's not good. We break bones, et cetera, et cetera. So another thing about cholesterol is with too much cholesterol, as I said, you're hardening your arteries, right? It gets deposited as plaque on your arteries. So I want to just back up a minute and give you a little bit more background here, because the arteries have a function besides just being a conduit for blood. They're not just like a PVC pipe where water or blood runs through. Actually, they have a function. They're alive, and they contract and they dilate. So it's called vasocontraction, vasodilation. And what that does is it keeps the blood moving through the artery. So the heart pumps, right? Sends the blood out to the body. But that pump, that one pump, is not going to get blood all the way to your fingertips or all the way to your toes. It's just not. That's not what it's designed to do. You have a secondary system, and that system squeezes and squeezes and squeezes. And so the blood keeps going through your arteries all the way down to the very end, to the capillary beds, where the exchange, the nutrient, oxygen, metabolic waste exchange takes place, and then it sends it back up through the venous system. So when you harden those arteries with plaque, that system can't work either. So not only are you narrowing the vessels themselves, so the blood has a smaller area in which to travel through, but also that squeezing motion can happen. You lose the musculature there. And if your arteries are hard, then that muscle, that squeezing can't happen. So it's a double whammy there, actually. So my point is that you get plaque all throughout the arteries in your body. We've been talking about coronary plaques because that's what we've been talking about. But you actually get plaques throughout your body, including your brain. Now, like I said before, your brain is a nutrition and oxygen hog, right? And a glucose hog. So it's got to have energy and glucose. It's got to have nutrition. It's got to have oxygen, and you've got to get that metabolic waste out of there. Well, what if the arteries in your brain have plaque, right? And you can't get oxygenated fully. What's that going to do? Well, I'm sure you've heard of beta amyloid plaques. Well, that's Alzheimer's. Those are associated with Alzheimer's, right? You may or may not have heard of vascular dementia. We know what those two words mean, but put them together, and what that means is that you're getting dementia because your blood flow is not giving your brain the nutrition and the oxygen that it needs to function. So you're getting dementia. Part of your brain is starting to die, and you're losing memory, you're losing cognitive function, you're losing cognitive processing, you're losing frontal lobe, so you're losing the brain. And that's not good, right? So another reason to get your cholesterol down. But when you take a statin, you get exactly the same things as side effects. You get memory loss, you get confusion, you get a reduction of cognitive processing, meaning it affects your brain in a very similar way as high cholesterol or plaques on your arteries might affect your brain. So that, to me, that's not a choice. That's not a choice I want. I want a different choice. We're going to talk about a different choice in a minute as soon as we get through these risks. So another big risk is it increases the risk, these statins, increase the risk of developing diabetes. That's not good either. Also, finally, these are the big ones. There's lots of little ones that we're not going to talk about because I could talk about it for a really long time. But long-term use of a statin may double a woman's risk of invasive breast cancer. So if you've ever had breast cancer in the past, and now you have heart disease and you have atherosclerosis, you certainly don't want to take a statin because you're just increasing your risk that much more of developing breast cancer again. So those are the big side effects, the big risks with taking statins. There are two more that are not, they're a little bit of a different quality than those risks, but there are two more that I want to mention because they're super important, and they're super important to me personally. So besides the fact that they don't really work as commonly thought or as presented to people, the list of side effects is pretty horrific and long, and that billions, not millions, billions of dollars are needlessly spent on these drugs every year. There's two other downsides. People think they're protected, and that's a problem. They think they can eat whatever they want, live however they want, and this statin is providing a safety net, and it's just not true. The statin will take care of them. So they won't ever have any problems with heart disease or heart attack because they're taking the statin, and it's just not true. So it's a false sense of security. And then secondly, prescribing the drug takes away an opportunity to really get to the heart of the matter, to get to the root of the issue, and to really look at the facts, right? To look, it's taking away an opportunity to address the root cause and get it corrected at that level. Because here's what happens. If we address the root cause of any one of these chronic diseases, whether it's heart disease or diabetes or cancer or any other chronic disease that you can think of, if we address the root cause, we're just cutting off at the knees the source for all other chronic diseases. So with one solution, we're potentially solving any number of problems. Right? And what traditional medicine wants to do is we want to put a Band-Aid on top of each one of these chronic diseases and solve it from a symptom perspective. But that's not solving the problem. That's just Band-Aiding the problem. And I'm really not about Band-Aiding anything. I want to get to the root of the problem and solve it from there, because then you can solve so many other problems, right? If you just solve it from the root. So think about this. Even with all the drugs that are being prescribed in this country to prevent cardiac deaths, including statins, but so many others, blood pressure medications, whatever, heart disease is still the #1 killer of men and women. Still the #1 killer of men and women, even with all these billions of dollars that are spent on medication. So now let me ask you a question. Are you ready for a change? Are you ready to transform your life? Because it's not about a statin. It's not about blood pressure medication. It's really about a fundamental change in lifestyle. And that requires a transformation. It's a transformation in belief system. It's a transformation in relationships, relationship with food in particular, relationship with yourself, relationship with your own mind. Are you ready to set yourself up for a healthy life? Are you ready to get on the path of healthy longevity? Because if you've listened to me talk at all ever, you know that that's my passion, is healthy longevity. I want people to live a long life, but only if they're in a healthy, vital body. Like, you can live a vibrant life until you're 100 years old or more, and you've got a really strong, healthy body. You don't have heart disease. You don't have diabetes. You don't have cancer. You don't have all of these chronic diseases. You don't have pain riddled throughout your body, right? That's what we want. But on the standard American diet, with the standard American lifestyle, we're not going to get there. We think all these diseases are diseases of age. They're not. You don't have to get these diseases. There is a way around it. And because this is a Facebook group for right-sizing your body, it's also about weight, right? How much weight are you carrying on your frame? Because that's another thing that gets solved. It's almost a side effect. If you really dig deep and transform your life and transform your relationship with food and transform your diet, and I am not talking about a diet that you do for 2 weeks or a month and you lose 1,000 pounds and then on day number 31 you gain it all back. That's not what I'm about. I'm about transforming your lifestyle, transforming your relationship with food, getting on a food plan that works for you in every way possible, and the weight just comes off. Your blood work just clears up almost magically. It just clears up, and your doctor goes, "Wow, what are you doing?" You tell him, and he goes, "Oh yeah, whatever," right? Because that's kind of the way it is. So if you're ready, seriously ready for that kind of transformation, and I mean, transformation requires some work on your part. Okay, I'll guide you through it because I've done it, and I know how to do it, and I've taken a lot of people through this kind of transformation. I know how to guide people, and we get results. People who do the work, they get great results, and they're super happy. So if you're ready for that kind of transformation, I would love to talk to you. I'd love to talk to you more and see if the program's right for you. It might not be. You might not be ready for it. It might not be what you need to solve your problem. But if you've got a statin problem, if you've got a heart problem, if you've got a weight problem, if you've got a food mind problem, a relationship with food problem, and you want to talk about it and see what's possible, private message me and let's set up a time to talk. I would love to talk to you about it and see if this is a good program for you. See if I can help you. I would love, love, love to help you if I can. So private message me. I would love to talk to you, and let's get your health and your weight on the right track so that you have a life of healthy longevity. Thanks so much for joining me, and hopefully I will see you next time, and I'll hear from you on a private message.